All right. Seems like we have a pretty good group of people here, so we're going to go ahead and get started. Thank you, everyone, for hopping on, and welcome to the NBSTRN Monthly National NBS Pilot webinar for May 7th. And just a reminder, please mute yourself on Zoom, or if you're calling in, you can press, I believe, *6 or *8, maybe, just to mute yourself, and it'll run a little bit more smoothly. So today, our agenda is going to be doing some introductions, and then we have a piece related to the SMA newborn screening reevaluation by the committee to add SMA to the RUSP. And then we will be receiving updates from the pilot teams and other states that are screening for the candidate conditions, a new steps update, and then an update from NBSTRN. So just to start, there is an upcoming meeting, I believe at the end of the month, with Alex Kemper and the ACH-DNC team working on reevaluating SMA as a RUSP condition. And so they are asking for additional information from other people screening, piloting, or researching SMA. And if you have any information or anything that you think would aid in the reevaluation, you can either bring that up now and we can take some notes about it, or you can either, sorry, could you please mute yourself? Couldn't see who that was. Still hearing some background.
We tried to have him.
Okay. Okay. Well, so back to the SMA. If you have any information that you think would be useful in reevaluating or reevaluating SMA as a RUSP condition, you can either bring it up now, or you can either email NBSTRN or Alex Kemper. I can send out, or I can repost Alex Kemper's email address on the APHL New Steps forum as well, for those of you who would like to reach out to him. Is there anyone that has any questions about this? Okay. I'll post that email, and hopefully someone has some information for him. And I guess I forgot on the agenda, if there's any new state screening teams that are out there that are just joining, or any new members of teams that have joined, if you'd like to introduce yourself to the group and just give a little backstory of what you're doing currently.
Hi, everyone. I'm Kate Kucera. I just joined the group in North Carolina. I'm the director for the lab, and I have lots of molecular testing background and bioinformatics. Nice meeting you.
Great, thank you, Kate. We got an update from your team last month that you would be joining us, so I'm glad to hear your voice. Okay, now moving on to updates from the pilot states. Is there anyone from New York on the line?
Hello, this is Joe. I'm from New York. Can you give an update?
Great, thanks.
Yeah, so I'll go through the new conditions we're screening for with updates. So ALD, we're up to about 1.5 million screens, so 1.6 million screens, somewhere in that range. We've had 44 boys that have been referred that have ABCD1 variants. Most of these are confirmed as ALD cases, and then 47 females with ALD been detected. For Pompeii, we've screened roughly 1.4 million. We've referred 160 babies. 8 have had classic Pompeii disease and 1 with non-classic Pompeii disease. Then for MPS 1, we've screened about 400,000 babies. We've had 20 we've referred, but they've none of them have come up with classic form of MPS 1. There's 1 or 2 that have been possible for later onset version, but likely aren't late onset, just being watched. And then SMA, we've seen the same number as IDUA, around 400,000. And we have 8 that we've, or 15 total SMA cases, 8 of them with 2 copies of SMN2, 5 with 3 copies, and 2 with at least 4 copies. And that's our pilot screening update. If there's any questions, I'm happy to take them.
Sorry, how many had 4 copies?
2.
2?
There's also Michelle and Colleen are on the line, so we can kind of cover any kind of questions you may have related to any of the screening.
Does anyone have any further questions that they'd like to bring up?
This is Michelle. Probably should clarify that the 4 copies are at least 4 copies. We can't distinguish 4 from 5 from more.
Great, thank you for that clarification.
Oh, Jesus Christ.
Any other questions from the group? Okay, great. Well, thank you for that update.
You're welcome.
All right, is there anyone from Georgia on the line?
Yeah, this is Angela. I will be brief because we don't really have any updates. Our pilot ended, as we noted at the end of last month, and we're just working on our report. And we're still screening statewide, though, for SMA. It's just now part of our panel, and no new cases since we all last met.
Great. Any other, or do you guys have an update on PCD, or are you guys still holding off due to COVID?
Yeah, the PUCD is still on hold. We are working on, my brain is going to work. We are working on updating our version of the Clear tool for that project. We've got about 3 weeks of data, I want to say, put into that tool. So Trisha Hall is working on that for us, and then we'll evaluate it and hopefully be able to get back up and running on that.
Okay, great.
How many babies to date? Maybe Art can update. On that screen was the end of, what was that? The end of March, I think, was the 170,395 that's there on the screen. And I don't know if Art's on the line, but, you know, let's see, we get a little over 10,000 babies a month. So there was no break. So add about 10, you know, roughly probably another 20,000 onto that number.
Okay. All right, are there any questions for the Georgia team? Okay, great. Well, thank you for that update. All right, is there anyone on the North Carolina team on the call?
Hey, Kevin, this is Blake. Kate's also on, but I'll be giving the update for this month. We've continuous screening. We're up to 7,834 with no positive screens for SMA. I'm not sure if I've given this update yet, but we have a no-cost extension to continue screening through the end of this year. So we'll continue doing SMA screening through December 2020, and then hopefully at that point, the state lab will be closer to implementing their test on the newborn screening panel. This is all done within our early check research study currently.
Okay, and what was the number screened again? Sorry, I just missed that.
7,834.
Okay. Great. And are you guys still recruiting online? And if there's any changes to that?
We are still recruiting online. Luckily, it's one of the, research recruitment methods and approaches that is still operational, since we don't necessarily have to have in-person recruiters in hospitals, which a lot of hospitals have stopped their recruitment. So that's been one positive. But we are hearing from our partners that we may be getting back into hospitals doing more engaged recruitment efforts within the next few months. But we're obviously, taking that one day at a time.
Yep. All right, great. Thanks for that update. Are there any questions from the North Carolina team? All right. Just a few updates on our kind of plans for a few presentations here in the next coming months. I talked about this last month, but we are going to have a presentation by Dr. Sylvia Tortorelli and Dr. Piero Rinaldo from the Mayo Clinic on June 4th regarding their second tier test for MPS 1 in Pompeii using creatine and creatinine. Is there anyone from their group on the line? Okay. So just plan on that on June 4th. And then we've also been in contact with the Cure SMA group. And we have decided to allow them to present on August 6th regarding their kind of efforts with Cure SMA. And I believe Dr. Mary Schroth, the CMO of Cure SMA, will be leading that. Is there anyone from the Cure SMA team that would like to expand on that?
Yes, I'm here. I don't know if I... Hi, can you hear me?
Yep.
Great. Yes, so I will talk about the Cure SMA efforts to promote and support SMA newborn screening.
Great. And never mind. Sorry.
Go ahead,
I had
ask.
something there.
Go
I
ahead.
thought I had something there, but then I lost it.
And I just want to thank everyone for allowing us to participate, or at least be listening in on these calls. We are trying to track the number of babies who have been identified with SMA through newborn screening throughout the country. So we have emailed several of you to try to gain that information. We've also requested access through New Steps. So if there's a way for us to gain, and we're just looking for the numbers. We're not looking for identifying information, but just trying to track how many babies there are in the country would be really helpful.
Is there, if anyone has any information, is there an email address that they can contact you at?
Yes, you can email me directly at Mary, M-A-R-Y, at curesma, one word, .org. Perfect. Thank you.
Of course. Are there any questions for Mary? Okay, great.
Thank you.
Are there any other groups on the line that have anything they would like to bring up, or any other reports on the newborn screening kind of environment in their state?
Hi, this is Kim Piper in Iowa. We are on track to start an SMA screening pilot July 1 of this year. Still moving forward. We're building our capacity right now. We are validating our assay and should be ready to go July 1.
That's great to hear. We look forward to some updates from you and your team.
Hi, this is Michelle in Kansas, the Kansas lab, and we are going to be starting our pilot for lysosomal storage disorder on May 14th.
Awesome. That's great to hear.
Hi, this is Greg from Colorado.
Hi, Greg.
We went live with SMA on January 20th. Yesterday, we had our 5th case for the year.
Fifth positive case?
Yes. So
great. And do you have an update on how many have been screened?
So we have 68,000 annually, so we're probably right around 30,000 since going live.
Okay.
Prior to this, when we did our initial study, we had 3 cases that we found in 2019 when we were doing our validation. And that was, so we were just setting our cutoffs. It was a limited pool that we had, and I believe that was only, those 3 were found in like 15,000 cases. So we've had a total of 8
okay.
from our pilot, and then 5 are after we went live.
Great.
Hi, this is Cindy.
Hi, Cindy.
Hi, I'm Cindy from California Department of Public Health. And as for California, we will start screening for SMA starting on June 24th. And we're in preparation and completing our validation.
Fantastic.
We'll put it with your
Is there anyone else that would like to provide an update?
This is Ona Adair from South Carolina.
Hi.
Hi, ONA.
Do you have an update for us? Hello?
I'll jump in. This is Jordan Schober from Pennsylvania. On the SMA front, we've screened 148,000. We have 12 positive screens. 9 of those confirmed SMA diagnosis with 3 pending right now.
9 confirmed, 3 pending. That's great. Are you guys still in the pilot phase, or?
We've moved out of that. Yep. So everybody's going to be tested from here on out. Yep.
Okay. Great. Is Iona still on the line from South Carolina? Okay. We'll just leave that blank for now. Are there any other groups on the line?
This is Allison from Indiana.
Hello.
Hi. We will start screening for MPS 1 and Pompeii July 1.
No. Where is it? Open it.
Awesome.
And I guess to add to that, Crabbe.
And Crab?
Guess what? Open it once.
And are these pilots, or are you guys adding this to your panel?
This will be added to our panel.
Great.
What do you say when you want something? I know, what do you say?
Is there anyone else on the line with an update?
You said those? No.
Sorry, again, if you could please mute yourselves, that would be great.
Open it, please.
We're still getting some background noise from someone calling in. If you could please mute yourself. Okay, is there anyone from APHL on the line that has any updates for us?
Hi, no updates.
No updates? Great, thank you. Guess we already went through that. All right, well, is there anything else that anyone would like to bring up? Okay. Well, with that, I guess we can conclude this. Thank you all for tuning in and providing us with updates. We've heard from a lot of states today, and sounds like a lot of great stuff is happening. So thank you for hopping on. I will post Alex Kemper's email address to the APHL New Steps forum under my update today for the call as a comment, and then I will also be posting this recording to YouTube under the NBSTRN account if you would like to come back and review. So thank you all for tuning in, and can't wait to hear from you all next month. Thank you all for hopping on.
Thank you.
Yep,
Thank you.
thanks. Bye.
Bye, everyone.
Bye.
Thanks. Bye-bye.
Hey, Kevin, are you still on?
Yes, I am.
Hi, so this is Cindy again from California. And
Hi.
so I sent you a private chat. I just want to, I guess it's easier to just talk. Can you sort of expand what you mean by reevaluating SMA for RUSP?
From what I understand, the advisory committee is reconvening to, I guess, review the evidence gaps or see if anything has filled those evidence gaps from the last time it was reviewed. And I believe it's at the end of the month. And so I guess these are the questions that they're trying to address here. And so do you have any kind of screening data that you think would be beneficial to that?
No, not right now, because we have not started screening yet for California. So yeah, the plan is still to go live on June 24th, pending, everything else goes well. So there's no, you're not, or actually they're not talking about taking SMA off the RUSP. Is that right? Okay.
No, yeah, they're reevaluating putting it on. I guess there were a few evidence gaps that they were wary of the last time they reviewed, and so Alex Kemper has been kind of leading the effort to gather all the data to re-present it all to the advisory committee.
Oh, I see. I thought it's already on.
No? I guess not, or maybe there was something else.
It is on the RUSP.
Oh, okay.
But in their letter, they said that they would reevaluate. It's at one time in the letter that the secretary put on something about going back and reevaluating the condition.
Yeah, so that's why I'm a bit confused. So it's already on, so they're re-evaluating it so that they can take it off or leave it on? Is that, what are they re-evaluating?
I'm not sure. I don't know if they didn't feel comfortable adding SMA. But yes, it was one time that they put that in the language that they were going to reevaluate it.
I see. Okay. Yeah, I didn't see that that update email, so I missed that.
I see on the RUSP website right now, it's spinal muscular atrophy due to homozygous deletion of exon 7 in SMN1. So maybe they're re-reviewing what kind of mutations are needed in SMN1 to kind of warrant SMA, or I don't know.
Okay. Interesting. Do you happen to have that update email or from
not readily available.
You said you're gonna send out a message about this.
Yeah, and I can I'll check with Amy again and see if she has the email regarding it, and then I can send you another email regarding what exactly they're reviewing, if you want to put your email in the chat.
Yeah. Yeah, because this would be good to know, because we're all gearing up to go live.
Yeah.
Because it's already, we thought it's on the RUSP and that it's going to be there permanently. We're not planning for it to go away. And I mean, we've made a lot of investments, in terms of equipment and staff. So, yeah.
Yeah, I don't think it'll be anything too game changing, but yeah. So I have your email here. I'll check in with Amy and see if I can get a little bit more explanation of what exactly they're representing to the advisory committee.
Okay, sounds good. Thanks, Kevin. And thanks,
great, yeah, thank you for checking in.
Mr. Balmer, for your input. Okay, thanks.
Great. Thanks, everyone.
All right, bye.